Hello everyone! So this time I'm going to show you or demonstrate to you how to use the goniometer. Alright? The goniometer is a tool that we use to measure the range of motion of a specific joint in the body so that we can know if there are any limitations of motion that we have to address from the patient. Just to be more specific, as you can see, the goniometer has numbers on the circles like a protractor, and it has an arrow here and a line here. Before we get into the measurement itself, it is also important for you to know that this is where our background knowledge in anatomy is very important, because before you perform the range of motion assessment, you have to identify the specific bony landmarks where you can place the fulcrum or the middle part of the goniometer, and where you could align the stationary arm or the moving arm of the goniometer so that you will be able to identify the specific points for measurement of the angle. Alright? So, now let's try to demonstrate. Okay, so everyone, I don't have an available patient right now, but I have Mr. Teddy. Okay, so we will try to provide an example of on how we use the goniometer for measuring the range of motion. So for example, we want to measure the range of motion of the hip joint, okay, of Mr. Teddy. Alright? Now, what we're going to do is to first identify the specific bony landmarks. Now, for a human or for a person, the bony landmark for hip flexion is the greater trochanter. Okay, that is the fulcrum of the goniometer. And then the stationary arm or proximal arm should be aligned or parallel to the lateral trunk of the person. Okay? And then, the distal arm or the moving arm of the goniometer should be aligned on the lateral epicondyle of the person. So, for example, this is the lateral trunk of Mr. Teddy. This is his greater trochanter, and this is his lateral epicondyle. So, we will align the goniometer. So, this is what we do. So, first, you align the goniometer to the specific bony landmarks, okay? And then you try to look what is the specific measurement that we have here, okay? So for Mr. Teddy, it starts with at least not zero. So at least 5 degrees of flexion. So hindi po siya naka-flat zero, no? May slight degrees of flexion or bend already on the hips of Mr. Teddy. And then, for example, we will ask the patient to flex the hip. Okay? So, the stationary arm would stay on this side, but the moving arm would follow the movement and still align it on the lateral epicondyle. So, for example, it is still here. Ayan. Alright. Now, as you can see, this is the angle that we got for Mr. Teddy. Now, we can read it as 0 to, no, not 75, 65 degrees. Alright? So, meaning, the hip flexion of Mr. Teddy is from 0 to 65 degrees. Okay? So, usually for a person or a human, the normal hip flexion is at 0 to 90 degrees, okay? Considering that there is no tightness on the other muscles. Now, for example, if Mr. Teddy only reached up to 60 degrees, then somehow we could say that there is a limitation of motion on his hip flexion. So, that is a quick demonstration on how to use the goniometer. Okay?